Coming this way, Mr. Rodriguez. Follow me, and before you sit down, could you please step on the scale right here?
Sure.
I need to get your height and your weight. Okay. Okay, now you could go ahead and have a seat here.
Thanks.
Okay, let me just wash my hands real quick. Okay. So, first of all, let's go over your information. Do you still have the same health insurance, the Medicaid?
Yes, I'm retired and on fixed income.
Okay, and you're still living with your wife in the southwest side of Tucson?
Yep.
Okay. And could you tell me your age, please?
67.
Okay. And who's your emergency contact?
My wife.
Okay, that's who we have down here. I just want to make sure it didn't change. And so your height and your weight today, you're 5'8", and you're 150 pounds.
150, that seems a little bit low from, I think, from the last time I came in for a checkup.
Have you been trying to lose weight?
No.
No? And have you changed your diet at all?
No.
No? And what about your appetite?
That's definitely been decreased over the last few weeks.
Okay, so you said just a decrease in appetite. All right, well, let's also go to, can you tell me what year it is and who the president is and where we are right now?
At the VA hospital, and it is 2019, and the president is Donald Trump.
Okay, and I was expecting more for that. You looked like you had a comment to go with Trump or something.
I decided I'll just keep that to myself.
Oh, okay. I seen it on your face, though. I could read it there. So what brings you in today?
Mostly coming in because I've been a little bit concerned about the weight loss, but mostly it's been tiredness and some shortness of breath, and kind of developed a cough a couple weeks ago along with some wheezing, and thought it was just a cold, but the cough has been lingering on since then.
Okay. So this has been going on just a few weeks?
Mm-hmm.
Okay. And have you noticed like what brings it on when you're having this shortness of breath?
I mostly have noticed it whenever I'm playing with my grandchildren, so that's my main kind of physical activity, so it's whenever I'm engaged with them.
Okay. And on a scale from like 1 to 10 or 0 to 10, how bad would you say the symptoms are?
About a 3.
About a 3. Okay. And is when you do have this shortness of breath, is it like it's all of a sudden or is it gradual?
It's pretty much all of a sudden.
Okay. And how long does the shortness of breath last with you?
A few minutes, about 10 minutes or so.
Okay. And you said that it's affected your life by playing with your grandchildren. Anything else that it's bothered that you've noticed?
Well, it definitely makes it whenever it comes on, I have to sit down, which makes me feel really anxious about what's going on with it because I feel a tightness in my chest.
Okay. Okay. And what do you think are causing the symptoms?
I'm not sure. That's why I'm here talking to you.
Okay. When you have this cough, do you have any sputum production with it? Do you have like mucus?
Yeah.
Okay. And do you feel like you have like mucus in your chest quite frequently, or and has this been since the cough developed?
Yeah. Yeah.
Okay.
It came along whenever the wheezing started.
Okay. And have you noticed what makes it better or worse? Just sitting down is the only thing, or
So far,
Okay. Okay. All right. Well, I'm going to ask you a few questions about your background, and then we'll get into the assessment. Okay.
Okay.
So, do you have any cultural or religious considerations that we need to think about?
No.
No? Okay. And do you have a religion?
No.
Okay. And do you consider yourself spiritual?
No.
Okay. And there's no concerns as far as anything goes like that we need to address at this time?
No.
Okay. And you said that you're retired?
Mm-hmm.
Okay, and you're on Medicaid. And what medications are you on right now?
Metropinol?
Okay, all right. And what dose and how often do you take that?
Let's see, I think it's 25 milligrams once a day.
Okay. And so you have a history of high blood pressure. Is that why you're taking this medication?
Yes.
Okay. Any other medical history that we need to be concerned about? Any other diagnosis?
Nothing that I can think of as far as myself. No.
Okay. Any past surgeries or?
No.
Okay. And how has your sleep been lately?
Definitely restless and interrupted.
Okay. And do you feel that that's because of the way that you're breathing during the night?
I'm guessing it might have something to do with it, yeah.
Okay. And tell me about your exercise routine. You said that your main form of exercise was just the grandchildren.
Yeah, that's about all I do.
Do you and your wife go out for walks or anything else like that?
No, not really.
Okay.
Just playing with the grandkids.
Okay. Let's see. And have you had any pain in your abdomen lately?
No.
Anything? No pain in the abdomen? Okay. And then tell me about your health history from your family.
Well, let's see. My mother passed away. My mother is still alive, but her health has been declining due to uncontrolled diabetes. So I've got a brother and 4 sisters, then my wife, and then my father died a few years ago from lung cancer.
Okay. And you have any kids?
Yes, 2.
Okay. And you then, how many grandkids do you have?
2.
2. Okay. So do you feel like you have good social support then, since you have such a big family, you all get along and spend time together? Okay. Have you had any recent falls in the last, let's say, 3 months or so?
No.
Okay. What about your skin? Do you have any rashes, bruises, cuts, anything abnormal going on?
No.
No weird-looking moles or anything else like that? No?
None that I've noticed.
Okay. And is it just you and your wife living at home, or do your kids, grandkids, anybody live with you?
Just us.
Just you, okay. And tell me, are you sexually active still?
Yes.
Okay. And do you drink alcohol?
Yes. Usually just at like social events, barbecues, things like that.
Okay. So in the last year, how many times did you have 6 or more drinks on one occasion?
Probably 5 or 6.
5 or 6? Okay. And how many times a week would you say that you drink? 1 to 2, 2 to 3, 3 to 4?
At the most it'd be 1 to 2, but it's rarer than that. So.
Okay. And on usual night, do you have 1 drink, 2 drinks?
Usually at night, not just during social events.
Just the social events. Okay. All right. And do you use tobacco?
Yes, I'm a smoker.
Okay. How long have you been smoking?
About 47 years.
47 years. Okay. Have you ever tried quitting?
I have, but somehow I seem to always just fall back into it.
What's worked for you in the past for quitting?
Nicorette gum. It's
Nicorette
been
gum.
the most effective.
Okay. And when you were having success with the Nicorette gum, what was your longest period of time that you went without smoking?
A couple of months.
A couple of months? Well, that's still a couple of months to celebrate.
Mm-hmm.
Yeah. So good
Small
job.
victories.
And would you be interested in smoking cessation classes?
Sure.
Okay. We have some that before I'm finished with everything, I'll get you the information before you walk out the door, and we'll get you a referral over to them.
Okay.
Okay. And also, I think maybe we can talk to the doctor and see if maybe we can get you some Nicorette gum if you think that you're willing to try to quit again.
Probably can't hurt.
Okay. Only if you're willing and
Probably
ready.
the best for me if I do.
Well, I think that some of these problems that you're having with breathing and stuff, I mean, it wouldn't hurt for you to actually quit smoking. It's a good idea. Matter of fact, that's what we recommend. We haven't had diagnosis yet, but I would recommend it. Now tell me, do you use any illegal drugs, cocaine, marijuana, pills, anything like that? No?
Nope.
Okay. Did you ever use them in your life?
Nope.
Okay. And do you have any thoughts of suicide or homicide?
No.
Okay. Do you feel like...
Well, the wife once in a while, but...
Well, I think that might be normal.
It's only whenever I take out the trash and I get an earful.
Well, okay. Just over trash. All right. Well, let me just write this stuff down, and let's go ahead and get you vitals and get started with the assessment.
Okay.
Okay. So, maybe I need to pressure cut stuff here. You see your arm? Okay, go ahead and relax it. Okay, and let me see this, just a finger off this hand. This is going to just take your oxygen levels there. And if you could pull your hat up for me a little bit there. This is just a temperature thermometer here. Okay, 97.6 for that one. And okay, so let me write all this down here. Let's get this off of you. Okay, so your temperature was 97.6, like I said, Your blood pressure is still a little bit elevated. It's 164/82, so we'll mention that to the doctor and see if maybe we need to change your meds a little bit or something.
Okay.
Your heart rate is at 80, which is still within the normal range, but it's a little bit high. And then also your oxygen is a little bit low right now. It's at 91%. And then your respiration rates, because we count them, we don't tell you we're counting them, but a little bit high. It's at 22. How do you feel like you are for your breathing right now?
I'm doing okay.
You're doing okay? Okay. All right. Well, I'm going to actually start doing more of the assessment. Can I take your paper here?
Sure.
Do you need that still?
Nope.
Okay. All right. And can you remove your hat for me?
Sure.
I'm just going to fill your head. I'm just going for any knots or something like that.
Didn't know you guys did phonetics here.
Push up for me. Good. Okay. Push right here. Tell me if you have any pain.
Nope.
Okay. And you're in pain like this?
Nope.
Okay. And let me see. I'm going to grab this scope here. Look in your ears.
Did I pass the wax test?
Oh, there's a lot of wax in there.
Oh, man.
Well, that's okay. We've got some stuff that maybe we can get you to help loosen it up if you would like me to talk to the doctor about that, okay?
Probably can't hurt.
Yeah, let me grab a little bit over you. I'm just going to change the tip, okay?
Okay.
So I'm going to look inside your mouth. Okay. And say ah. Okay, good. Now, tip your head back. Okay, everything looks good there. Let me go ahead and put this back. Okay. And I have a pen light here, okay?
Okay.
So first I'm going to have you just look straight at my nose, okay? Good. Okay, now I want you to watch the tip of the pen, okay?
Okay.
Very good. Get that back in my pocket there. So I want you to smile for me. Okay, raise your eyebrows. Stick out your tongue. Frown. Dance. Just kidding. No, I'm just checking your nerves.
Oh, okay.
I know, it seems a little weird, right?
I know. Part of the medical stuff.
It is part of the medical stuff. So let me grab my scope so I can listen to your heart and your lungs real quick. So I'm going to raise your shirt. Is that okay?
Okay.
Okay. Take a nice deep breath. Exhale. Another one. Exhale. Again. Exhale. Again. Okay, let's do 2 more. And out. And then again. And out. Okay, I'm going to reach down the front of your shirt. Is that all right?
Okay.
And you don't have to breathe deep this time, just breathe normally.
Gotta warm that thing up before you use it.
I know. Sorry about that. They keep these places freezing. Okay. Good. And now I want to listen to your stomach, so we're going to raise your shirt up just a little bit.
Oh, okay.
Okay, nice good vowel sounds there, at least. Put that back there. So everything looks good as far as that goes. Your lungs do sound a little bit dimmed, so I'm going to report that to the doctor as well. Okay.
Okay.
So now I want you to grab my fingers, squeeze them as hard as you can. Squeeze, squeeze, squeeze. Very good. Put your arms out like this. Okay. Flip them. Back again. Out this way. Very good. Okay. Now I'm going to lift your feet, okay?
Okay.
Can you take your shoes off for me? Okay. So first, I'm just going to feel for the pulses down here. Good. Good. Check for any swelling. No swelling. Push up on my hands. Good. I'm going to push down. Good. All right. Now, I would like you to stand up for me.
Okay.
Okay. And I'm just going to check just your mobility on your joints, okay? So that's what we're doing now. It's like when I checked your arms just a second ago. So I want you to twist your hips out like this, one at a time. Good. Now the other one. Good. Rotate your foot in a circle.
At what point do I turn myself around?
Yes. Right now, if you'd like to. Very good. Okay. And then just raise your legs for me, one at a time. Okay, good. Now, if you'll turn away from me, and then I want you to bend over and check the alignment of your back. Very good. Very good. We're almost done. So now, if you just will sit back down one more time. Now, if you lay down this time, I just want to feel your stomach.
Okay.
I know. Good thing this doctor's office has nice, comfy pillows.
Definitely.
Okay. So I'm going to raise your shirt back up.
Okay.
And I want you to tell me if you feel any pain or anything whenever I'm pushing around. Any pain?
Nope.
Do you ever have any problems with urination?
No.
Okay. And you said that you were sexually active.
Mm-hmm.
Do you have any concerns in that area? No irregular stuff with your skin or discharge or anything like that? No?
Nope. Other than, kind of haven't been able to perform since all this came on.
Okay. We could talk to the doctor about that as well. I'm just listening to the sound. See if there's any.
Make sure it doesn't sound too hollow.
Well, the different sounds can indicate different things. Go ahead, you can sit back up.
Okay.
So when you learn to listen to the different sounds as you're tapping, you could tell how much it resonates inside there, how solid something is, or if there's something else going on inside there. So now we talked about the smoking cessation classes. You said that you would be interested in doing that. I'm really happy about that. But I have to run, I think I should do a couple more tests just because you're having these lung issues.
Of course, it's always more tests.
Yeah. So we're going to go ahead and we'll get some blood before you leave and just check on a few things there. I'm sure the doctor's going to end up running that. And then I have this other little device over here. This is going to go in your mouth.
Okay.
Okay, and before you use it, I want you to take as deep a breath as you can and then exhale as hard as you can through the device.
Okay.
Okay. Okay. Did you just drop it?
No.
Okay.
Still holding it.
Okay. Let's see.
Like that?
Nope, I'm going to have you do it 2 more times. I just want to
Okay.
see what the average is.
Okay.
Go ahead and do it again. Okay. And great. Thank you. All right. So I will let the doctor know how that turned out. And then let's see. I have this questionnaire here for you, okay? I'm just going to ask you the questions and you just let me know what the answers are, okay?
Okay.
So do you have shortness of breath with strenuous exercise?
Yes.
Okay. And do you have shortness of breath when you're hurrying on a level or walking uphill slightly?
Yes.
Okay. What about, do you walk slower than most people your age because of breathlessness? Do you have to stop and breathe when you're walking at your own pace on level ground?
Mm-hmm.
So do you have to stop for breath after walking about 100 meters?
No.
Okay. And do you feel like you're ever too breathless to leave the house?
No.
Okay. Okay. And then these next questions I'm going to ask you, they're on a level from 1 to 5. Okay?
Okay.
So 1 would be like on the first side of the question that I ask you with no symptoms, and 5 would be the worst that the symptoms could be. Okay? So do you never have a cough, or do you cough all the time? 1 to 5.
Probably about a 3 right in the middle.
Okay. And do you have phlegm in your chest, or do you have no phlegm in your chest, or feel completely full of phlegm?
Kind of in the middle, so probably about a 3.
Okay. And does your chest not feel tight at all, or do you feel tightness in your chest?
Probably about the same, a 3.
Okay. And when I walk uphill 1 flight of stairs, I'm not breathless, or I'm very breathless when I walk up 1 flight of stairs.
Not very, so probably about a 3 or so.
Okay. And I'm not limited to doing activities at home, or I'm very limited to doing activities at home.
Kind of partial, so probably around, I guess I'm batting 1,000, probably a 3.
Okay. And I'm confident in leaving my home despite my lung condition, or I'm not confident at all in leaving.
I say we just keep going with probably the 3.
All right.
Kind of in the middle.
All right. And I sleep soundly, or I don't sleep soundly because of my lung condition.
I wake up some, not all the time or anything, so I guess we're sticking with 3.
Okay, good. And then I have lots of energy, or I have no energy.
Kind of in the middle. So
Okay.
it's 3 again.
Okay. So we got this test and the spirometry. We're going to go ahead and see if the doctor's going to order that blood work, and he might also want to order a chest X-ray for you. So if you just want to sit tight for a little bit, and I'll have the doctor come in and see you. Okay?
Okay.
Okay. Thank you for your time.
Thank you.
I just want to call myself out on this and let you know that I did assess the walk when the patient came into the room and left the room. And I did notice that the patient had mobility in his head whenever he was talking to me. And I forgot to press on the fingernails and check for the return and to look at them for clubbing. I didn't verbalize that or do that, so I just wanted to say that so that maybe it will count for not getting marked off on those points. Thank you.